Good evening. Hope wonderful Sunday, super fantastic night.
Yes. Well, Doc, we're hearing about a number of reactions, as you just heard, to the vaccine. Should people be actually concerned about these reports, and what should they do if they are having these symptoms?
I think the bottom line is that any type of adverse reaction to any vaccine, especially J&J or any of the vaccines for, especially for the SARS-CoV virus, if you have a problem, you need to make sure you get into the system earlier. I mean, we're still early in the science on vaccinations. I think people need to understand that there's not a year, 2, 3, 4, 5 years of hard science and medicine to these vaccines. So right now, we're still in the early stage. And this is why these vaccines are called experimental use authorization vaccines. They're still figuring out clinical trials, figuring out what the reactions are, the adverse reactions for different people. So it's gonna span the whole gantrum, everything from people having Guillain-Barré syndrome, people having Bell's palsy syndrome, people having thrombosis and clot formation. They die from the vaccine, and you're going to have people that are going to have basic anxiety because of the nervousness of the platform on the vaccine, where people are just scared of getting shots and stuff. So there's not one spectrum. I think it encompasses all, and that's just the reality of any type of vaccine program. People are going to have the whole gantrum as we figure this stuff out over the next several years.
And so, Doc, just kind of my experience the last couple of days, I got the vaccine myself, and then feeling a little bit of dizziness and a little bit of clumsiness, finding myself like almost tripping over, and I even fell yesterday. So I'm wondering, like, do you know if it's the anxiety that contributes to that specifically?
No, that's not anxiety. That's just part of the vaccine, and that's because what's happening is your body is trying to make an immune reaction to that virus that's been injected in your body. I mean, a vaccine is really a modified a virus that's been killed. It's been modified to be able to elicit an immune reaction to you for you to build antibodies. So when you have a vaccine that's injecting it to you, you can have every spectrum from inflammation, you can have a fever, you can have nausea, diarrhea, you can have headaches, you can have loss of balance. All these fit into a pattern of a vaccine. So this is one part of the understanding adverse effects, and every individual is different, and that's why over time we will get a better understanding of what the true adverse effects of people getting vaccines and these vaccines that are used for the SARS-CoV vaccine right now.
Yeah, because I mean, they say, okay, it should happen about 2 to 3 days, but for me, it's been 3 days, so you just never know what your experience will be. Well, we know Black folks are already hesitant about the vaccines, and when they hear this type of stuff, does this give people another reason to choose not to get the vaccine?
Yeah, I mean, absolutely. I'm a pro-vaccine person. Like I've said before, and I've done thousands of vaccination programs in the jungles around the world, in particular in Peru, vaccinating kids for all types of diseases, from measles, mumps. But the reality is that, when it comes to Black folks and African Americans, even colors of people, brown, Native Americans, people are going to have vaccine hesitancy. That's just the way it is. You can't sugarcoat it because of the horrors of what's happened in here in the United States, from the experimentation on Black folks, from the Tuskegee syphilis experiment to Dr. Sims cutting out Black folks, especially women's vaginals in Alabama without anesthesia, the experimentation, and all the other healthcare problems we have, from diabetes, high blood pressure, Black folks getting their legs cut off, etc. This has been part of the history of America. So Black folks or minorities are going to have a vaccine hesitant. Who wouldn't? Because of the history of this country. And now everybody's pushing vaccines. Where were they a year ago when Big Mama had diabetes in the Mississippi Delta? Where were they 5 years ago when Big Mama had an asthma attack or had high blood pressure? If you're going to do a program about humanity and understanding medicine and talking about the health of a particular population, especially minorities, then you have to be consistent 100% of the time. You don't get to pick and choose. You always have to give people love and care. That's just the reality.
And Dr. Rowland, I'll admit I'm one of those people who sometimes become what they call a hypochondriac, and you start thinking you have stuff because you've read certain things. So should people who get vaccinated report every little thing they feel in the days following the injections? For example, if your arm is itching, like where I got the shot here on my left side, or if they have a headache that day, how do they know when to actually report it and whether or not to bother their doctors?
Well, I think the reality, it comes down to one thing, is how do you feel? What's your homeostasis? You know your body better than anybody on the planet. You know when you get a headache, maybe you don't get headaches, maybe you have diarrhea. You know how you feel. And so if you do get a vaccine or whatever it is, you're taking a medication, if you feel uncomfortable, that is what the healthcare system is for. It's for you to go into the system, your doctor, your primary care physician, and talk and find out what your problem is and make sure that you feel comfortable. If you feel comfortable and your body feels comfortable, then you have a psychological advantage because you know you're well. You're not sick. You don't have an adverse effect. So if you have a problem, get your question answered by the appropriate people. Make sure they answer your question and that you feel very comfortable because this is a long-term. Folks, I'm sorry, but you will be getting multiple vaccines, boosters for the next 50 years. That's just a fact. That is where we're going because of the different variants, the viruses, and people need to get ready because this is our new norm.
And that's good information there. Doc, last question. You were telling me right before we got on that there's another variant or another virus out there that you wanted to tell us about.
Well, we've talked about this for the last several months. I've talked about this for a year and a half. Folks, people need to get ready, and you not need to be complacent because what's happening in India, what's happening in Brazil, folks, I tell folks, if you really understand diseases, and diseases are equal opportunity employers. I've talked about this at the Tuskegee Healthcare Disparity Conference. I've talked about how the viruses can change society. What's happening in India, what's happening in Brazil will happen here in the United States within the next month to 2 months. That's just reality. You talk about over 500,000 infections a day. People are dying like flies in India. Folks, it is coming to the United States. And this virus, you can look it up yourself. It's called the Bengal virus, Begal from West Bengal, India. It's a triple mutation. Let me repeat it again. It's a triple mutation SARS virus that is wiping out the people in India and part of the P1 out of Brazil. So, folks, this virus is coming. Make sure you continue to mask up, biosafety, biosecurity protocols. Make sure you wash your hands. Do not get complacent. These folks at the Kentucky Derby, they're going to become super spreaders. And I can promise you, mark my words, when the triple mutation virus, the Bengal virus gets to the United States, we will be heading back to another lockdown. That's just the science, that's the medicine. So make sure you continue to protect yourself. And also, the triple virus has also been found here in the United States from people from India.
Well, Doc, bringing us the bad news we don't want on a Sunday night, but we appreciate you for giving us all the information that we need to get us fully equipped. Thank you for your time.
Well, like the Congresswoman said, we're here to save lives. My responsibility is to save lives, and as many lives as we can save, and if we can save one person's life, hearing the information on this platform on a Sunday night, we've done our job because, folks, we have a long ways to go. I promise you that. There will be a long ways to go, and we have to be prepared. And the only way you can be prepared is you have to have information, and information based off of science and medicine is a key to our survival. And like I always say, I love being on this show, and another super fantastic Sunday night.
All right. Thank you, Dr. Rowling.